childhood obesity, are you treating those? And if you are, what are the medications for the kids?
Yeah. So obviously, I mean, the childhood obesity, it's a big term, but it's definitely an epidemic. Very sad, very, 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 very big problem. Because a lot of times when you read like an article about obesity or weight or the obesity kind of epidemic, the first sentence always is in these articles is that the rate of obesity now in the country is 1/3 of Americans are obese, 2/3 will be obese or overweight. But then they say a key kind of also word there is that 1 out of 6 children are obese. And if you look at that kind of number in what will happen, that means like in 15 years at least, the whole population is going to be 2/3 of it obese at least. Because also there's another very sad fate right there is that children that are obese have a huge probability of staying obese.
And
Teenage developing
chronic
more
conditions.
early conditions, correct? Like, of course, especially the teenagers now that we see, and those 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 cases are very, very, very sad. I think I would say the word sad, but again, we always think that there's new ways to help. In our program, we want to help. We definitely limit the prescriptions for the children and the teenagers. There's one medication that is approved for this group. It's called Orlistat or Xenical or Ally. I mean, I don't like that one at all. It's very, very hard to use. You have to be on a very strict diet. I haven't prescribed it at all in my career. There's another little window of evaluating the patient, the kids, first of all, metabolic picture, and a lot of it also has to do a big component, the genetic and of course the lifestyle. But we can help with motivating. We wish and we know from research that to have a solution or to have a good a result, you need a kind of a team approach. You need more a multidisciplinary, and you need a lot of coaching, a lot of parent involvement, a lot of much. But in terms of the medical, of course, we can evaluate kids for like metabolic syndrome, and we use sometimes like metformin. Kids that are struggling with a little bit of like the depression and the other mental and psychological effect, we can help there. Sometimes we prescribe medications. We prescribe now like a lot of vitamin D for kids because we know that is helpful. We talk about a lot of it has to do with the follow-up, and a nice, very, very nice term, my favorite term actually in childhood obesity is something called prevention plus. If you look at these kind of like protocols for treating kids, one of the first one is called prevention plus. Like for the pediatricians who see the the kids, they should talk about, okay, let's prevent this from getting worse. And I think that is the key, and that's what I believe is going to be where the hope is.